is my absolute pleasure to introduce Liz Thayer, who is the Associate Professor in Paramedicine at Western Sydney University, and Alecka Miles, who's a lecturer at Edith Cowan University and a PhD student at Western Sydney University. And they're going to be presenting on the Australasian Paramedicine Workforce Survey. So please join me in welcoming Liz and Alecka.
My name's Liz Thayer. I'm an Associate Professor of Paramedicine at Western Sydney University. I'm also the lead investigator of the Australasian Workforce Survey for Paramedics. This is a 3-year survey with data collection occurring every year for 3 years. And we have, in the first year, in 2023-24, we received 1,236 responses. There wasn't, and there's still, until very recently, isn't great comprehensive workforce data for the Australian paramedicine workforce. Now, that's not to say that there isn't health workforce data. If you look at nursing, if you look at medicine, they've got phenomenal workforce data sets.
We've also done some important work around workforce, and today presented our first year of our 3-year project into the paramedicine workforce research. So that report was delivered today and really key in us looking at where the workforce is going in the future.
It looks at the Australian and New Zealand workforce for paramedicine, and the team that is working on this is from Western Sydney University, Edith Cowan University and Auckland University of Technology. And between those 3 groups, we have developed a unique survey that we haven't seen before in paramedicine, where we're asking paramedics about their current workforce experience, but also their future expectations and intentions. And we're also engaging paramedicine students to see what they want into the future.
Hi, I'm Alecka Miles. I'm a paramedic who works at a general practice clinic in Perth and a lecturer at Edith Cowan University. My role in the Paramedicine Workforce Survey, commissioned by the Australasian College of Paramedicine, was the lead researcher for Edith Cowan University. I helped to assemble the team, develop the survey, and we've worked with a number of researchers across the university and in Western Sydney and Auckland University of Technology.
So the need for satisfaction, 20% of paramedics in Australia or New Zealand have 2 or more employers. And at least 40% of those working in education roles and at least 18% of those in management roles have more than 2 employers. And I think interestingly it does show that whilst people are progressing and working outside of ambulance services and in non-clinical roles, many of the people in non-clinical roles are still crafting and keeping some clinical roots to keep in touch with why I think most of us joined paramedicine in the first place.
The CPD challenges from the workforce study was actually quite interesting. 53% of the participants across Australia and New Zealand stated that there was a lack of access and opportunities. We didn't get a chance to explore greatly in depth what those meant, but some of those respondents did come from rural and remote areas. So I think that by access, given that other data suggested that face-to-face CPD was the preference for the participants, that contributes, because if you're in a rural area, it can be quite difficult to access that face-to-face CPD, which is a huge barrier. It is also interesting in a digital age, and whilst this didn't come up in the survey data, that access was still problem, but I do think that that may have been related back to the preference of how CPD is consumed by the paramedic participants in the survey, which was face-to-face. There were a few other barriers that we found to CPD from the participants. There were 4 other main ones. The 17% stated they were overworked or tired, 14% stated family commitments, 8% said the expectations were excessive, and interestingly, only 8% said the cost was a barrier. They also referred to a lack of employer support and leave opportunities to go to more extensive or longer CPDs. So many conferences, even outside of paramedicine, would be more than 1 or 2 days, and lots of people are working that shift cycle of 4 on 4 off, which makes it difficult around family commitments to travel to conferences that are, say, 4 or 5 days without leave support from your employer.
We found that below the age of 40, the majority of participants were female, and yet over the age of 40, especially when we were looking at management roles, there were far less females and the majority was male. Compared to a lot of other health professions, women entered the paramedicine health workforce a little later. So in some jurisdictional ambulance services, it wasn't until 1987 that women were employed. Having said that, currently student populations are predominantly female within paramedicine, and there are also factors within paramedicine that impact progression of women within that employment, especially if they're taking on caring roles, that part-time isn't always available, and so that impacts then progression into management, which often doesn't allow for part-time. We asked paramedics what their experience was of being a carer. We considered caring for children, so those under 16, but also for older family members. 1 in 5 paramedics said that they had caring responsibilities for older family members, and nearly 50% said that they had caring responsibilities for younger children. Paramedicine is becoming increasingly diverse, but there is still a long way to go. When you look at the Australian community, you cannot be what you can't see. And so we need more women in management roles, we need more diversity from minority groups, and we need support within flexible workplaces that allow for caring and that encourage those particular groups to come into the profession.
Given my role as a paramedic in primary care, it was interesting but not entirely surprising that only 2% of the participants are working in primary care. There was another 6% that work in mining, industrial or offshore, which arguably would be in a primary care setting as well because they're working in health clinics, so that could be up to 8%. I do think the other really interesting thing is that outside of education and jurisdictional ambulance services, there is still another 24% of paramedics who are not working in those primary paramedic employers. So 24% in total across other areas is quite interesting. I'm lucky enough to be doing my PhD exploring the roles and work of paramedics working in primary healthcare, and I actually have some data that I'm analysing, writing my first paper up on what these paramedics, which interestingly 24% of the participants of this survey are doing in these roles, and that varies from Aboriginal and Maori health services to defence to aged care and including GP paramedics. It does also include paramedics who are working in primary care roles within a jurisdictional ambulance service too, because this is something that's not new in jurisdictional services.
We want to make a better workforce. We want to make a better workplace, and we want a workplace that you want to be in for a long time. And so after Alecka and I have a chat, Gemma's going to give you a bit of an idea from the college perspective of what we're going to do with this data.
The survey was released in July of 2024 and has already been submitted to the New South Wales Government Special Commission of Inquiry into Healthcare Funding.
We've been really excited to have the data from the report and then use that within our own, to inform our own strategy across advocacy, how we work with our members and in design of our education programs. But really, it's how can the health sector, how can the those big decision makers that work beyond paramedicine use this survey to help inform healthcare. So from a big picture perspective, the workforce data can really inform, obviously, education, training, build their understanding of the location of the workforce, but also the appetite of the workforce to move outside of traditional settings and perhaps what some of those enablers and barriers are. This information can then be used to help develop and inform and design policies, which will obviously then have a greater impact on person-centred care, particularly in those underserviced areas.